I want you to think about this clip next time you decide to go raw in some strange.
The retail price of HIV medications for 3 months is about $16,000.
You hear that? $16,000 every 3 months. There used to be government funding to help offset some of those costs. Because, I don't know, $16,000 every 3 months, you got to be damn near rich. But those are getting cut. They'll eventually go away altogether. So, you know what that means. It's all out of pocket. Now, I found this video circulating on TikTok. It's a guy, he details a story about some dude moving to Houston and catching HIV. I don't think y'all guys realize how common stories like these are.
How many times do I have to say it about coming out here to Houston looking for a relationship, man? Guy posted something on YouTube, TikTok, and Instagram. He moved here about 3.5 years ago, man, because he wanted to come to Houston to connect with a female that he met through Instagram. She looked good, standing behind a car, nice fitted outfit on, body was banging. Got here and found out that it wasn't what he thought it was. His story is that when he first met her through Instagram, that she claimed to be a nurse and going to school to on her own dentistry office or whatever. Get out here. A week after he moved out here, a week before she moved out here, she claimed that she lost her job, her car was getting repoed or had got repoed, and that's just not the crazy story. After they started dating for a while, he noticed that she started disappearing from home a lot, and then when she would come home, she would have all of her friends over, and he didn't have a job, so he didn't have medical insurance or anything like that. He started messing with her and everything was good. About 3 weeks into the relationship of him moving out here to Houston, he ended up contracting something that caused him to burn when he was urinating.
All right, so let me explain what's going on. Guy meets a girl on Instagram. She might have a lot going on for herself because she says she's a nurse and she has her own practice. So the guy decides to fly to Texas to move in with her. I think the dude thought that he hit a lick. He doesn't have a job. He figured Houston might be popping. I can live off this nurse while I get on my feet. Now, his first mistake was trying to make a nurse his girl. Bruh, you already know. I ain't even gotta elaborate. His second mistake was moving to a new state with no job lined up. Third was moving in with a chick. You don't move in with women, especially when you've never met in person. How about a couple visits to see what this chick is like in person? Are y'all even compatible? And if y'all do decide to make it official, you get a new place together, or she moves in with you, or at least have some money in your pocket just in case you have to find another place to stay. Anyways, a week before he moves out there, she loses her job and her car. Bro should have aborted mission right then and there. Seems to me like she was looking for someone to save her.
A burn when he was urinating. We know what that is. That's that big G. You guys don't know what the big G is? That stands for gonorrhea. So he's online crying about.
I never heard her refer to it like that, the big G. I don't know if y'all know this, but STDs usually are accompanied by other STDs. So the big G might come with the big C or the big S or herp. And sometimes that HIV.
That she burned him, he caught gonorrhea. He swore he never cheated on her. He didn't know anybody out here. Now that's 3 weeks after he moved out here. Now, come to find out, he's online saying that he has HIV symptoms, guys. It's a sad story to see this man on here crying like this, but it's real. And this is why I say, coming out here to Houston, man, trying to date, man, you're going to end up catching something that not even a doctor can get rid of. Now, in the video, he did say that he's healthy, he's taking medication, that's kind of keeping it under control a little bit, but he's heartbroken because he said that she knew that she had HIV and she should have told him. I think that that is a crime. That should be attempted.
She knew she had it and didn't tell him. And it is a crime, but a lot of people get away with it.
When you willingly know that you got a virus like that, you're supposed to tell partners, people that you're about to engage with, especially if it's going to be something in the bedroom. So now he has to live with this for the rest of his life. He also went on in the video to say, because he contracted what he contracted, there was no need for him to leave her because nobody else would.
Which is exactly why she didn't tell him. A lot of infected people think like this because they feel like if you got it too, well, nobody else is going to want you, so you might as well stick with me. Anyways, long story short, stop thinking with your wiener. The link to the full video is going to be down in the description.
Now, a recent report released by Harris County Public Health shows the Houston area has a higher rate of HIV and other sexually transmitted infections compared to the rest of the state.
Yeah, Dr. David Pearce, the chief medical officer for the city of Houston, is here to talk with us about this information. I mean, Dr. Pearce, it feels like we don't hear a lot about HIV anymore. So can you kind of just start to talk to us about what it is and why this is still very much a threat?
Yeah, thanks, Haley. So, it's a good news, bad news sort of situation. So HIV stands for human immunodeficiency virus. And this is a virus that will slowly infect and disable parts of your immune system so that you then become susceptible to other infections that you otherwise wouldn't get. But in addition, one thing that many people don't realize, it also puts you at higher risk for certain cancers. Mm-hmm. And so it does this by slowly infecting your immune system and disabling it. And the bad news, as you pointed out, is that, we don't hear about it so much anymore. So there's, people don't pay attention and worry about it and take the precautions that they need. And so we need to get our mind back on that and start focusing on protecting ourselves because it is a lifelong problem. You can't get rid of it. There are ways maybe to control it, but once you have HIV, you then have to deal with it for the rest of your life.
Yeah. And so this report really shows us that it should be at the top of mind here in this.
And yes, it should be at the top of mind because you will be in debt to the healthcare industry, your doctor, for life. You are a forever patient. $16,000 every 3 months. I don't know how much that is over the course of a lifetime, your shortened lifetime, but you are a walking ATM machine to them. This might be by design. That's a conspiracy theory I don't want to get into right now, but
area, so people should be on the lookout for symptoms. Can you explain what those symptoms are? Like, how would somebody know that they have it?
Yeah, and so this is great question. And this is one of the challenges that we have with HIV, because when you first become infected, you won't have any symptoms for maybe 2 to 4 weeks afterwards. And then those symptoms are going to be body aches and fever, sores maybe in your throat, limp.
Remember, he said 2 to 4 weeks afterwards, not immediately, not 3 days. And usually people don't tell you until after you get the symptoms. And you ask them, why am I sick? And they'll be like, oh, because I gave you that forever, that HIV.
Nodes, feeling weak. Well, those are symptoms that you get with many viral illnesses, including the plain old flu, right? And the flu is bad enough. But my point is that there's two things. One is the symptoms of the early HIV infection are very common, and they are about 2 to 4 weeks after you got exposed. So people may not even connect whatever it was that they did that put them at risk for contracting HIV. And then when they get these, sort of routine viral symptoms, so they don't necessarily think to get tested. And that's one of the things we need to do is if you had a risky behavior, then you need to go ahead and get tested if you develop any symptoms, even if it's several weeks later. Then, and here's the other hard thing, then the HIV goes into what we call stage 2, and this is chronic infection. And guess what? Now you're infectious to others, but you have no symptoms at all. Your immune system is slowly weakening, but it's still healthy enough that it protects you from infection, so you don't know that you are HIV positive unless you get yourself tested, but you can spread it to others. And then the final stage is stage 3, and this is called acquired immunodeficiency syndrome, or what everybody refers to as AIDS. And this is when your immune system has finally gotten to the point where it cannot protect you, and you start developing all kinds of different infections, and as I pointed out, some cancers as well. The only way that you can know whether or not you have HIV is to go ahead and get tested. It's a simple blood test, and it's available many, many places. But really, you should go ahead and get tested, especially if you have any symptoms or you have a lifestyle that puts you at risk.
I mean, any indication as to why, or did the study say why rates seem to be higher in the Houston area than the Texas average?
Yeah, so there's a couple of things that contribute to that. One is that we are a big metropolitan area. The other thing is that, and we can talk about how it just doesn't get the attention that it needs to. The HIV doesn't get the attention it needs to. And so we also see in the Houston area, we see other sexually transmitted illnesses. And by the way, HIV is not only transmitted sexually. There are other ways that you can contract HIV.
Oh.
It's not just Houston. It's all over the place. It's Atlanta. It's if you're in a big metropolitan area, Houston, Atlanta, New York City, LA, Chicago, you're at higher risk than anywhere else. But people move from city to city, from small towns to cities to small towns. Just because you're in a small town doesn't mean you're in a safe space. It does not. Just because you're not in Houston doesn't mean this can't happen to you. I have a story later.
But we see that, these sort of waves of it going up and going down where we start paying attention to things, and then like syphilis and gonorrhea, those numbers start going down. The thing about syphilis and gonorrhea is once you're cured from them, you're cured from them. With HIV, you then have to get on the medication, and you need to stay on the medication or else you're at risk for spreading it again. And so I think because we're a big metropolitan area with lots of people, and we've got a lot of young people coming to this town who are, very active sexually, this is one of the things that contributes to a big metropolitan area like Houston having so many cases.
Dr. Peirce, I know you mentioned some ways to treat HIV. There's also prevention methods too, right? Does the Houston Health Department link anybody up to using the PrEP pill or anything like that?
Yeah, these are other things we need to talk about. Thanks for bringing it up. So if you're somebody who engages in risky behaviors, there's medications that are called PrEP, and that's pre-exposure prophylaxis. There's also PEP, which is post-exposure prophylaxis. So number one, if you're going to be having intimate contact with somebody else, you should always be using a condom. Number two is if you're going to be in high-risk situations, talk with your care provider. And the health department does have some places, and I'll tell you about those in just a second, where you can get both pre-exposure and post-exposure prophylaxis. And then in addition, should you become infected with HIV, it can become what I'm going to call controllable, which means unfortunately you can't get rid of it. What you can get is so that your levels are so low that you won't be able to transmit to somebody else and you will remain healthy. So there's lots of options available for folks.
But remember, these are medications that you have to take constantly for the rest of your life, or your levels will raise again, and then you'll be able to infect other people. Again, the link will be in the description. Now, real quick, touching on that PrEP pill, did a little research, and it looks like that you have to take. So, if you're a male, you have to take this 7 days prior to engaging in those sexual activities with the infected. And if you're a female, you should start taking about 21 days before. Now, I want you to think about this. Obviously, the story about the guy that moved to Houston didn't get the heads up, and most people are not going to give you the heads up. Not 7 days prior, not 21 days prior, not ever prior. You're just going to have to find out afterwards. Okay, so keep that in mind, afterwards. Post-exposure pill, you have to take it within 72 hours. So remember, the doctor said you're not going to get symptoms for 2 to 4 weeks. People are not going to say or mention anything to you until you start getting sick, showing symptoms and start asking questions, and then boom. So that 72-hour window is long gone. Also, keep in mind the cost of these pills, $60 if you have monthly insurance, $2,000 if you're coming out of pocket. So remember that story. The guy's unemployed, homeless. You think he has insurance? Well, I mean, obviously his window's long gone, but even if she did tell him right afterwards, which you won't, but even if she did, think he has $2,000 to throw on some pills? So circling back on those federal cuts.
Houston is facing a quiet crisis, rising rates of HIV and STIs, especially in communities of color.
And now the very services meant to protect vulnerable residents are being scaled back as federal funding really hangs in limbo. HIV, a virus we know how to prevent, is up 17%, and syphilis cases in Harris County are up 125% since 2016. Hotspots include Montrose, downtown Houston, Cashmere Gardens, and OST South Union. And now some community clinics say they've had to pause their free testing just as infections are rising.
I've been living with HIV for 30 years now. Everyone I knew with HIV died. And without access to these programs, our lifespan may not be like it is today. It could be severely jeopardized because you don't have access to medications or medical treatment.
Texas is bracing for $119 million in federal cuts, including $25.5 million for HIV prevention, treatment, and emergency preparedness.
If I'm the person who lives paycheck by paycheck and I depend on these testing facilities, where do I go next?
Good question. It'll be very difficult to navigate the system to find opportunities where you can find an agency that does have philanthropic funds. The retail price of HIV medications for 3 months is about $16,000.
Without access to these programs, our lifespan may not be like it is today.
Wear those condoms, bro. It doesn't matter how fine she is, boy. You wild if you hitting chicks raw in 2025. I don't care if she swears she got tested last week and her paperwork is in the car. She's been celibate for 3 years, tubes tied, on birth control. She allergic to latex. Nah, bro. Honestly, if a chick is begging you to go raw, some alarms should be going off. Now, I'm going to give you some life advice y'all probably not going to like. You can't trust a girl either. Now, hear me out. Listen, let me ask you this. Will you bet your life that whoever you're with will never cheat on you? Now, I know 2 people that lost their life taking a risk like that. Now, I'm not trying to scare you or anything, but, all it takes is one time your girl go on a work trip or a girl's trip. She meets somebody who looked like her favorite celebrity, that nigga dirty, and her friends are hyping it up, talking about, oh, well, how can your man know? It's just one time. Girl, go ahead and do that. How he gonna know? She go raw. They both reckless. Next thing you know, a month later, she feel a little sick. Oh, it's just a little flu or whatever. I'll be over it. And she does get over it. The next thing you know, you sick. And then you like, man, what the hell? You at the clinic. You find out you got something from this nigga. You feel me? Nah, y'all not hearing me. You cannot trust anyone when it comes to your health. Do not put your well-being at the mercy of somebody else. Not a judge, not a doctor, not a pastor, not your girl. We've all seen the Maury clips, right? He made a whole career off of exposing the infidelity of men and women. And you can basically take some time to look up the statistics by yourself. The often cited figure of 30% or more is usually based on the results of paternity tests conducted when doubts of paternity already exist, not in a random sample of general population. So what that means is that it could be more, could be less. I would argue that probably more than 50% of relationships, somebody's getting their cheeks clapped or somebody's clapping cheeks. This makes a significant difference as individuals are actively seeking testing precisely due to suspicion, explains DNAtesting.com. Now, I don't want you to watch this video and start giving your girl the side eye, because one thing I've learned about catching women cheating, you don't have to go snooping at all. You don't have to go through her phone. You don't have to do all that. You don't have to dig. So it's pointless to even stress yourself out about it, because it will present itself. It always comes out. You just have to pay attention. In all honesty, you always got to pay attention to your girl. I mean, you have to pay attention to everybody around you, but especially your girl. And in the meantime, you have to protect yourself. Doesn't matter how long y'all been together. STD rates soaring through the roof, HIV surging, unemployment surging. Now people have more free time on their hands. And you know what people do when they have a lot of free time on their hands? They start humping each other. Social media influencing more women to be hoes. I'm telling you, man, it's a perfect storm to catch a stray out here. You have to be disciplined. Being disciplined and not thinking with your other head is going to save you a ton of money and maybe even your life. So y'all stay safe out here, fellas, and wrap that shit up. I'll catch you in the next one.